Can you reverse TMJ? Absolutely. Now, that's a good question because not a lot of people brought about TMJ. Now, move thy limbs. You know, you can also use the neurolymphatics up front and back, but look at the parathyroid gland. This would be very important in calcium utilization, dear. You really want to get that parathyroid up because I can tell you, 9 times out of 10, I always see a parathyroid weakness in TMJ. So you want to get your calcium utilization up, move these acids out, where you can get a strong jaw again. You don't have the catching to it, you know, and it's the same with all the joints. You know, and start moving that lymph system. Get your kidneys and your adrenals up, start filtering, clean the bowels, do all those things we've been talking about. But you in particular, you want to make sure that parathyroid is working and calcium utilization is up there. Because it's not only going to be TMJ, it's going to be the teeth, it's going to be the gums, it's going to be the upper C-spine, things like that. And you want to fix that. And go after this because that also could lead you with spider veins, varicose veins, bruising easy, a little depression. It could breed you into a lot of things. But you're such a lovely soul, I can tell the way you wrote this. Love you, dear. Thanks for the comment, too. Working on it. I have a big problem with my TMJ, all right? Now, I can't chew my food properly. If I choose to chew, I choose to break my teeth because my jaw moved to the left and my occlusion and bite are off. My teeth started to break since January. Only recently I found out why and was diagnosed with TMJ. I have a lot of other issues because of this particular joint, but this problem with my teeth and not being able to chew my food breaks my heart. Okay, so let's stop right there. Where do you guys think this young lady needs to go? Parathyroid. Make sure it's not a pituitary too. You know, look at your height and your menses and stuff like this, but you've got to, if you're breaking teeth and everything else, I know the stress factors, but you know, the reason for the TMJ in the first place, you got to work on your parathyroid gland. You work on your parathyroid gland and you start cleaning your lymph system. You get your acids out of your body, get your lymph moving out of your head area and everything else, so your body can rebuild the jaw and replace it. I mean, rebuild it, realign it, and heal it up stronger. It'll do that. But you got to fix that parathyroid because your teeth are also probably brittle too. So, and you're going to see other things happen this way, bruising easy, maybe a little unhappiness or depression, maybe some varicose veins, spider veins coming, cramping too much, a lot of things like that can start creeping in. But you want to fix that parathyroid gland. And you want to detox, detox, detox. Get your body out there. Make your body put this in. And I would take the parathyroid. I myself would do 1-3 times a day with the Bones formula at 2-3 times a day. It'd be what I'd be doing to really kind of give myself some regeneration here. At the same time, I'm looking back to my parents and everybody else. Why do I have TMJ? Why would I have a parathyroid? Because why would I be losing my skeletal what's the word I want? Skeletal health. And you're going to go back to, of course, acidosis and that sort of thing, but also you want to check that parathyroid. Now, why would the parathyroid be down? Well, you hear all that mucus I'm pulling out of my bronchi and stuff? Thyroid, parathyroid become full of that too. You know, full of acidosis and inflammation like everything else. Everything's tied to the same. Everything's tied together. When you start seeing malformation of joints and everything else, I mean, you got to look at genetics, of course, but you also have to go back to why. Even in genetics, what causes the deterioration or mutation of cells and their consciousness? I know I have this issue because I have a lot of stagnant lip in my head area. Hair loss, see? Absolutely. Chronic rhinitis, gums disease, there you go. You're so acidic that everything's getting dehydrated and brittle on you, so you're cracking teeth and everything else on it. So you want to hydrate. Hydration is a base balance experience which comes naturally when you eat fruits, berries, melons, and vegetables. It's just that fruits, berries, and melons are your detoxifying foods, and that's the level you need to get at. Because you got to get the head going, you got to get cold and flu-like symptom going, get your sinuses draining, and get all this cleaned up so we can rebuild that. But at the same time, I would force that through there with the parathyroid and the Bones formula myself. And you might have to revisit using that a couple of times through the next 6 months or so. See, you have teeth problems, gum problems, chronic tonsillitis, chronic laryngitis, Hashimoto's, cervical spondylitis, swollen lymph nodes. You see what I'm saying, sweetheart? You are loaded with acidosis. All this is just acidosis. And you can fix all of this. And you're going to want to fix all this because you're a young woman. So you want to fix all of this. And this is all just acidosis. And you're probably full of mucus. So, you got to get your kidneys filtering, just like we've been talking about on all these videos. You got to get your adrenals up. You got to get your bowels cleaned out so all this can start draining out. And you'll fix all of this stuff. All of this stuff's very fixable.